Hey YouTube, we're back
Again.
Tiff, Steph.
Yes, welcome back. Thanks again for tuning in. Steph and I decided to pivot just a little bit and go into hypertension or high blood pressure because with this being September 2021, we started thinking that we do not want you guys going to the hospital because that hospital is full of people right now. So we don't want you going there. Okay, so we thought let's try to do something around some preventative care around high blood pressure, right? Because this is something that you can control, some with the help of a provider. Okay, so let's just dive right into high blood pressure. So of course, let's define it. So hypertension is really just defined as the pressure inside of your blood vessels. It is the pressure, how much pressure is up against the vessel. Mm-hmm. The more your heart has to pump against narrow vessels, the higher the pressure is. Heart working hard. We don't want that.
We don't want your heart working that hard.
Mm-hmm.
You only have one.
Yes. And so when the heart has to pump really, really hard, what that does is it increases the blood pressure. Mm-hmm. And so, does that come with symptoms? Do you get symptoms, Steph?
Well, most of the times you do not get symptoms with hypertension. It's called the silent killer. Reason being, you don't feel anything. Mm-hmm. Some people may have some symptoms, so they may have a headache. Mm-hmm. Oh, my head is hurting. Mm-hmm. You know, some tingling, arms, limbs, mm-hmm. something like that going on. Mm-hmm. But for the most part, hypertension is asymptomatic.
Mm-hmm. Mm-hmm. Let's talk about the normal range. Normal range for blood pressure should be right around 120/80. So that's normal. That's where we want you to be, 120/80. Mm-hmm. But as we know, a lot of times that's not the case. And so if the blood pressure is higher than that, then we got to get in and get some treatment, correct?
Yes, absolutely.
Mm-hmm. Because what happens if we just let it go? Because you know how people do. They like, well, I feel fine.
Let me tell you what happened. Stroke, heart attack, CHF,
congestive heart failure,
death,
mm-hmm.
and kidney disease.
Mm-hmm.
Kidney disease.
Mm-hmm.
Most of the time, you don't really die from it. It leaves you in such a debilitating way. You don't want to live like that. Mm-hmm. So be very careful. It's very silent. It's easy to manage. Mm-hmm. You have to see a provider for it. Mm-hmm. And there's a lot of things you can do to bring it, decrease it yourself, bring it down.
Absolutely.
And you have to work with your provider. You have to work together in order to get blood pressure down.
Absolutely, absolutely. So when you go see your provider, that's one of the first things they do is they check your blood pressure. It should start at about 18. Technically, you should be getting your blood pressure checked every year. Definitely by the time you're 40, but if you have a family history of hypertension, you really should be getting it checked every year. Mm-hmm. But if you don't have a family history, you're not of the African American or Hispanic background, they say a textbook says every 2 years from the age of 18 to 39 for people with low risk, but then every year at the age of 40. Mm-hmm. But if you're high risk, you should be getting it checked every single year.
Yes.
Mm-hmm. So what are some of the risk factors that put us at high risk for
you named one already, heredity, mm-hmm. ethnicity.
Mm-hmm. Yeah, if you're African American.
Yeah,
you're
Hispanic.
Mm-hmm. Yeah.
Mm-hmm. Foods high in sodium, eating foods high in sodium, a lot of packaged, processed foods, meats, mm-hmm. Are very high in sodium. So my favorite, this is her favorite thing. Learn how to read the label. See a nutritionist to help you understand what that sodium means on that pack when you're reading the back of the label. Or that frozen dinner. Ooh, those are usually high in sodium.
They be tricking y'all.
Yeah.
They be tricking you on that label.
You're like, oh, that's only... No.
Or like the front of the package is beautiful, right? You look at the front of something, it's just they got all that marketing and it looks so cute, and you be like, this gonna be good. Yeah, it probably is till you turn it over, and that label, it just be jacked. It be jacked. And so it's so important to see a nutritionist.
It is, so you can learn how to read labels.
Gotta learn how to read a label. That's where they trick you.
Mm-hmm.
They put all the bad stuff on the label.
Guess what else?
Oh,
I don't know if y'all gonna like this one.
y'all not gonna like this one. Yeah, I'm so sorry.
Sorry. Well, ooh, you break it to her.
I'm
It's
not
her. I make her tell you.
Alcohol. I'm so sorry. I'm sorry, y'all. I know we got a limit. We gotta do better. I know, y'all. My patients be like, Tip, for real? I'm like, I'm sorry. What you drinking? How many drinks you having?
Yes. Yes.
I know y'all done took in that whole bottle of wine. Oh, I know. You can't. It will make your blood pressure high.
It will. It will.
You gotta limit that alcohol. Recommendations are 1 glass for women. Men can have up to 2. I know. Don't shoot the messenger.
I'm sorry. Yes, that's a big one. Why you make me tell them? Because.
So another thing is, has a problem that weighs with you, your blood pressure is, the weight
From that alcohol.
from the alcohol
Sorry.
and the frozen dinners and the processed meat that you bought out the store in the bag that's already breaded and all that. Be careful.
That sounds me with the crackers.
Oh,
Oh.
it's so good. I love sauce meat. Ooh. Okay. So,
We with y'all. We be struggling too.
we do. You have to watch your weight.
Got to watch.
Lower the weight, it lowers your blood pressure by how much?
Every 2.2 pounds, y'all, that you lose 1 millimeter of mercury in your blood pressure. And whatever direction your weight goes, is the direction of your blood pressure.
Yes.
And what I know is whatever is measured is improved. Ooh, you mean you gotta get on the scale? You gotta get on the scale. Oh Lord, I put them on the scale. I know, I'm sorry.
Yeah. It's the truth though.
But you won't have no heart attacks.
You would not.
And you
No
won't
stroke.
be in that hospital.
You won't have your left side be moving and so is your right side. You be moving both of them. You won't be in there like this don't work no more. But you won't have both of them working. You can even go and monitor your blood pressure yourself. You can go buy you a blood pressure monitor. Any of the drugstores sell them. Any of the Walmart, Kmart, whatever Mart, Target, whatever Mart you shop at, whatever. They have blood pressure. They're not expensive. They have blood pressure kits. They're not expensive. You should monitor it yourself.
Especially if you're high risk.
Especially if you're high risk.
And if you're old like us.
We're high risk. We have the ethnicity,
We old.
old,
Family history.
family history.
We're so deep in our family.
Yes. So that's why we're always talking about healthy weight, exercise, eat right. Stay away from the processed foods, limit the alcohol.
Don't smoke. Don't smoke.
Oh, smoking.
Smoking.
I'm sorry. Smoking. Woo. Jacks it right up in the air.
At least try to cut back.
Cut back. And I know smoking is hard to stop.
Smoking is hard, y'all.
It's hard. But you can do it.
You can do it.
I have faith in you. You can do it.
You can do it.
Cut down.
Cut back.
Slow.
Yes, if you don't have to take that extra puff,
Don't.
put it out.
Absolutely.
Yes. If you want a video on smoking cessation, let me
Let
know.
us know.
I'm an ex-smoker.
Ex-smoker did it like a G.
Stop smoking 12, 12, 12. Yes, I did.
12, 12, 12.
Yes, I did, y'all. If you want to know how I did it without medication. If you want to know how I did it, I will break it down. I will tell you exactly how I did it. So, yeah, don't smoke because that'll lower your blood pressure.
It will.
Okay.
Inactivity. If you're a couch potato, well, it's hard for me to get up and then okay, do some exercise on the couch. While you're sitting in front of TV, lift your arms up, put some weights on your legs, move your arms. You know, get up, walk
Chair
to the
exercise.
mop,
This one said
vacuum,
do something.
walk
Move.
up and down the steps, move. You can't sit on the couch all day, eat processed foods, drink pop and smoke cigarettes or whatever you smoke, and expect that you're going to be, you're going to have low blood pressure, you're going to be healthy. No, you're not. It's going to catch up with you. The older you get, the more at risk you're going to be. You know? With your leggings on, watch them lie naked. Put some jeans on, like, oh, these are uncomfortable. Yep, because you need to get up and go for a walk.
And the hospital is not where you want to be.
Take your dog for a walk. Right now, hospital is not where you want to be. Hospital is not where you want to be anyway. Ever.
Nope.
But really, right now, it's you know, it's high because we have this whole COVID thing going on. So stay away from the hospital. Shout out to the healthcare workers for taking care of everybody.
Amen.
Shout out to you guys. Keep it up.
Thank you.
Yes.
Yes, and so you may not be able to do all of these things, but guys,
Do something.
do something.
Do something.
Try something.
Try something.
Another thing that will increase your blood pressure is high stress.
Woo.
From either, it could be your job. We know them jobs out there is creating a lot of
Yes.
stress. We know that.
Yes.
You know, you're gonna have to, guys, we're gonna have to give folks some grace. You have to walk away.
Yes. Grace and mercy.
Grace and mercy, you have to just walk away. You're gonna have to go, you know what?
Okay. You're right.
You're right.
I'm gonna go with
You know, you're gonna have to walk away. You're gonna have to give some folks some grace in order to maintain your blood pressure. That's gonna be at work. That's gonna be when somebody cuts you off on the road.
Yes. Oh yeah.
That's gonna be that may be at a restaurant when the waitress you ask for lemonade and you're like,
Where's my lemonade?
where's she at?
She might have had a bad day and something. Just smiled at her. Hey,
Hi,
hi.
hi.
Hey. You forgot my lemonade. She's like, oh my God. Kill them with kindness. Kindness always works. Be kind.
Be kind, because that's gonna help to prevent your blood pressure from going up.
Correct. And somebody's not going to say you're kind to them. They're usually not going to come back with something smart. You like, oh, see, now I just went there. See, now I got to come back down. So you don't want to do so. Be kind. What you give is usually what you get back. So it's hard for somebody to be mean to you if you're being kind to them.
Grace.
And your blood pressure will stay down.
Grace.
Also, another stressor is your adult children. Even your small children. 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 Your grandkids. Yeah. All those things can be stressors. Because those are yours.
Yeah.
And they really not going nowhere because those are yours. Okay?
And
It's
just
not
know-
like a piece of cloth.
They will increase your blood pressure.
Ooh, have it jacked up.
Yeah.
You'd be like, oh Lord, I gotta come back down. But and also a lot of people have white coat syndrome. That's just want to throw that in there real quick. White coat syndrome is when your blood pressure only gets high when you're at the doctor. So I just want you to recognize that. The doctor comes in the office, blood pressure shoots up to the sky. For some reason, you get really anxious and scared. What you need to do is, when you go in, have them not take your pressure right away. When you walk in, kind of sit down, chill out a little bit, 5 minutes or so, calm down, and then take your blood pressure, because that will not be a true reading. And then I'll say you have a high blood pressure and you don't. It's just you need to come in. When they come in to seat you and go through your meds, go through that first and then take my blood pressure. Make sure you tell them that, because sometimes they don't know, and they'll go right and then your blood pressure be through the roof and you be sitting there arguing with them. So no, we're not going to do that. Relax 5-10 minutes or so, let them go through their whole little spiel, then have her take it right before she walks out. That's to let you know whether you have white coat syndrome or really a high blood pressure problem.
Now, I just want to add on to what Stephanie says. The only way you're going to really know if you have white coat syndrome is you would have to be monitoring your blood pressure at home.
Absolutely.
Because you would have to know what your blood pressure is running
Correct.
at home. At home, I'm 120/80. But then when I come into this doctor's office, I'm 160/100.
Right.
And that's why it's so good to monitor and know your numbers, because then they'll go, Did I say I
She
did?
said-
And it's because you'll go in there and then you 160 over
Right.
100, and then they'll go, okay, well let me put you on lisinopril.
No. You don't need lisinopril. You just need 5 minutes. Bam.
But you got to measure.
You have to measure.
Yeah, you have to measure your
Absolutely.
blood pressure.
Absolutely.
Okay. All right. So what can we do to bring this blood pressure down, Steffi? Some of the stuff we already talked about it. Yeah. Okay. So one of the things that I find is a culprit with my patients in this blood pressure is reading the label, which Stephanie talked about, right? So we got a pop quiz. Ooh. We hated this.
Hated them. Ooh, be mad.
Like,
Quiz, lady.
right now,
Right. Yeah. Pop quiz.
we got a pop quiz. So, you know how you go to your auntie house? I got a sweet aunt. Her name Auntie Reed. We call her
Hey,
Auntie
Auntie
Reed.
Reed.
Hey, Auntie Reed. So we go to Auntie Reed house. That's where we go to eat, right? So we go to Auntie Reed house, get that burnt hot dog. You know for the holiday, right? You know that burnt hot dog. We ain't talking about the vegan one, right? Shout out to those who vegan out there. God bless you. This ain't the vegan hot dog. We talking about the regular old hot dog, right? So the question to you guys is, that burnt hot dog that you love so much, fresh off the grill,
With that soft.
with the soft bun, yeah, fresh. They just went and got the buns, okay?
Tasty.
You get that fresh hot dog. How much sodium is in that hot dog? Is it A, 500 milligrams of sodium, B, 1,000 milligrams of sodium, C, 1,500 milligrams of sodium, or D, 2,000 milligrams of sodium? How much sodium? I want you to write it down. You write it down. You got it in your head, or you got it? You got it? Okay. So Steffi gonna break down the hot dog. We got a hot dog with the bun, ketchup, and mustard. We're gonna keep it simple. Okay, that's it. Hot dog, bun, ketchup, mustard. Steph, break it down to them. How much sodium is in there?
Well, the hot dog by itself is 550 milligrams of sodium. Oh, Lord. That delicious soft bun. Wait, hold on. Wait. 220 milligrams of sodium. All off. And wait till you get down. This one right here just, I was like, what? Ketchup.
A serving.
One serving.
Which ain't much. It's a teaspoon.
160 milligrams of sodium. And the mustard, 56 milligrams of sodium. I do love mustard. So that's good. I just put mustard on mine. But
one serving.
all together now, did I add that up? 985 milligrams of sodium for that hot dog on that bun with a sliver of ketchup and a sliver of mustard. There you have it.
Now, you might be thinking, well, how much am I allowed in a day?
Woo!
When you are hypertensive, you are supposed to be on a low sodium diet of 2,000 milligrams of sodium a day. So when you then went to Auntie Reed's and ate one of her hot dogs, that's half of your sodium intake. So you eat 2 burnt hot dogs, mustard and ketchup. You done ate all your sodium
for the day.
For the day. So when you leave the barbecue and your ankles are swollen, ooh, that's the sodium.
That's the sodium. Lord. Okay.
Okay, you see why we want you to see a nutritionist?
Yes.
You see why we want you to see a nutritionist? Because you need to understand what you're eating. I'm not saying you can't eat hot dogs.
Hot dogs are good.
Hot dogs are wonderful.
But you can't eat them all the time. Limit yourself.
Limit. Be careful.
Just limit. You can't, eat 2 burnt hot dogs every day. Or you can't have 6. Some of them stay at the grill. You can't get another hot dog. No. Especially when you're hypertensive.
Especially when you're hypertensive.
Because not only did you have a hot dog, you probably had a drink,
some greens.
And another thing, do not add salt after your food is cooked. Do not add salt. No added salt.
Just eat it bland.
Eat it the way it is. If you didn't put enough on there when you cooked it, you don't need no more. Leave it
Tough.
alone.
Leave it alone.
You know that butter you slather, salted butter, and put on your corn at the barbecue. You know, all that counts. Now you know we just adding all that up. So
Don't
just
shoot us.
be careful. Just try to make you mindful of
Yes.
what you're doing.
Yes.
Mindful of what you're eating,
Absolutely.
what you're putting in your body, what it's going to do to your body.
Yes.
Any questions? Comments?
Yes.
Please, tricks that you know, things you can do. Hot dogs, you know, they have low sodium hot dogs. You know, they have less sodium hot dogs. But things like that, we're just kind of giving you a gist of what's going on. Please let us know tricks, tips.
And then we're doing, we got some content coming, guys. We're going to do diabetes. Woo! And we're going to do addiction.
Yes.
Ooh.
And bipolar.
Ooh.
All those things are coming up.
Yes.
Stay tuned.
Please. Thank you so
Thank
much,
you.
guys.
Bye.
Bye.
See ya.